Auzubillahiminashaitanirrajim. Bismillahirrahmanirrahim. Assalamu alaikum, brothers and sisters. Welcome to the program, Challenges of Muslim Identity and Mental Health Wellness. I'd like to begin the program by first off introducing myself. My name is Dr.kumail Hussain, and I am a child and adolescent psychiatrist, and I'm in practice. This topic of mental health is extremely important to me and extremely important to the Muslim community. 1 in 5 US adults experience mental illness each year, according to NAMI, National Alliance of Mental Institute. And 1 in 20 US adults experience serious mental illness each year. And then when it comes to the youth, 1 in 6 youth age 6 to 17 experience a mental health disorder each year. Now, one of the most common issues that we have when it comes to mental health is the stigma. A 2017 study, which involved more than 200 individuals with mental illness over a period of 2 years, found that greater self-stigma was associated with poor recovery from mental illness after 1 and 2 years. And this brings us to the topic of the challenges of Muslim identity and mental health wellness. As we know, there's still a taboo about mental health, which we are slowly starting to unravel. This topic of mental health, and especially Muslim identity, is very important. We have seen a skyrocket in cases of people coming in for mental health issues, especially after the pandemic started. And one of the most common misconceptions is, can you be Muslim and still struggle with your mental health? And this is why we thought this program was very essential for our community. And with that, I'd like to, on behalf of IEC Husaini Chicago and the Board of Trustees, welcome our 2 speakers today. To begin with, I'd like to introduce Shaykh Dr. Mehdi Hazari, who was born in Toronto, Canada, but he spent most of his youth in the Sultanate of Oman, where he received his primary education. His family moved to the United States in the 1980s. He finished high school and thereafter completed his undergraduate studies at the University of Florida, Florida Atlantic University, and then received his master's degree from the University of Toronto. He received his doctorate from Johns Hopkins University. He is a physiologist, environmental scientist by profession, specializing in neuro and cardiovascular physiology and studies of the effects of air pollution on human health. Shaykh Hazari is a resident scholar Alim of the Islamic Alibet Association of the Triangle in Durham, North Carolina. Shaykh Hazari is also a member of the Council of Shia Muslim Scholars of North America and a board member of the Imam Mehdi Association of Marjah. In addition, Shaykh Hazari has also contributed to the publication of Islamic books, authorizing the booklet Who is Hussain, and articles on numerous topics. And now, this brings me to our second speaker today. And on behalf of IEC Husaini Chicago, I'd like to welcome Sister Berak Hussain, who is a registered psychotherapist practicing in the Medical University Clinic in Ottawa, Canada. She has a BA in psychology and a master's in educational counseling from the University of Ottawa. She's also known as the Muslim Counselor and is a passionate public speaker in Muslim mental health, social justice, Islamic and women issues, and poetry. She speaks on a variety of Islamic psychological issues, bridging the connection and misconceptions around Islam and mental health and Islam and women. She has worked locally and internationally on a variety of mental health initiatives, working tirelessly to break the stigma around the topic within the community through TV documentaries, shows, and implementing wellness programs with widow orphan charity groups in Iraq. This work has led Sister Berak Hussain to work with the Imam Mehdi Association of Marjah, liaison office of Ayatollah Sayyid Sistani in North America, with the program development and implementation across North America. Sister Berak continues to encourage people to reach their full potential with the motto of inspire, heal, and empower. So I'd like to begin by welcoming both of you. Thank you for joining us. And Sheikh Hazari, if you could begin the program with the dua.
Thank you, Dr. Hussain. So let's begin with a Surah Al-Fatiha for all of your deceased relatives, the relatives of the mu'mineen, the mu'minat, the shuhada, our ulama al-kiram, our maraji'. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahman ar-Rahim. Maliki yawmiddin. Iyaka na'budu wa iyaka nasta'een. Ihdina as-sirata al-mustaqim. صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين صدق الله العلي العظيم.
All right. Before we begin the program, please, if you do have any additional questions, please comment on our YouTube site, and we will try to get through some of the questions. And some of these questions that we're going to ask today in today's program was actually compiled by a lot of the youth members of our community. And I'm going to begin with you, Sheikh Hazari. So one common question is, some youth have gained the misconception that if you are religious, you should not have any mental health issues, and vice versa. I am having mental issues not due to being religious enough. Is it because I'm not religious enough that I'm having this? So how can we appropriately address this?
So assalamu alaikum jami'an wa rahmatullahi wa barakatuh. First, I want to thank you, Dr. Hussain, the IEC Husaini, who I have had the honor and distinct pleasure of visiting, for inviting me for this panel. And it is always a real privilege and a pleasure to be with my dear and respected sister Berak, who I, alhamdulillah, have had the distinct honor of learning from a lot on these psychological issues. And let me begin by providing a disclaimer that by no means am I a psychologist or a mental health expert. So anything I say will be said from the position of a layperson. That being said, your question's a good one. So let me pose the answer from the perspective of a scientist and from someone who is a neurophysiologist. If you have cardiovascular disease, if you have any form of physical ailment or anything that occurs in the physical body, that response of your body, whether it is in your heart, whether it is in your lungs, whether it is in your gastrointestinal system, occurs because there is a message, a chemical, a signal molecule that activates a receptor. That receptor, when activated by the molecule, will cause the organ or the tissue to change. So you have what are called beta adrenergic receptors in the heart. When activated, they cause the heart to speed up. They increase the contractility of the heart. All of this occurs throughout the body. Every tissue of the body functions in this manner. Whether it is digestion, whether it is absorption of nutrients, every tissue in the body functions in this manner. Your mind works the same way. What does that mean? It means that the processes of the mind, although they are abstract to some degree, are still governed by the fact that you have chemicals and molecules in the body that interact with receptors and cause some change, an electrical signal. So when you say that a Muslim or a mu'min, a believer, someone who has faith in God, should not experience mental health deficits, you are essentially saying that that physiological change in your body does not exist. So it is not inconceivable that somebody who is a Muslim, someone who has faith in God, may experience mental health deficits. Why? Because their body is governed by the same electrical signals, the same molecule to receptor interaction that any human body is. And that is a separate issue from their faith in God. Now, can they be tied? Yes, they potentially can be tied. But to say that somebody who is a person of faith cannot or should not have mental health issues is absolutely incorrect. Why? Because physiologically, physically, our bodies are not governed in that manner. Our bodies are determined by the chemical reactions, the activation of receptors, and a whole host of other factors like your upbringing, the environment, the things you have experienced, all of what make you the person you are.
Thank you so much, Sheikh. So, this leads to the topic of, stigma about mental health and the common misconceptions that we may have. And, this question is for you, Sister Berak, welcome again. And is, how do we break the stigma regarding mental health within our Shia community?
Assalamu alaikum wa rahmatullahi wa barakatuh. Again, like the Shaykh, I'd like to begin by saying it is an honor to work alongside the group who's doing this, and also with your respected self, Shaykh. And I'm always learning from the Islamic as well as the scientific contributions that you always share in our programs, and reminded us again, subhanAllah, how the physiology has a huge impact on our mental health. And this is part of destigmatizing, is understanding the science behind it as well, right? The biology and how it's all interconnected. Mind, heart, body, and soul, they're all interconnected. So when we have that basic understanding through education, through psychoeducation, through normalizing, by connecting it to things that we already understand, like science, excuse me, science and Islam, then it becomes easier for people to kind of swallow that pill. Because right away with the stigma, the fear, the misunderstandings, the misconceptions, people are afraid to label themselves, so to speak. It's interesting to see that, especially within our communities. And this kind of stigma only in, let's say, the last 10 years or so has been more open in the non-Muslim population. And for us, it's been the last 5 years that we've slowly been opening up, where now, mashallah, everybody's talking about mental health. So many different programs and so many experts who are coming out and talking about it. And people, let's say, who don't necessarily have the hardcore psychological training, but have some kind of training along with their own expertise, whether it's science or Islam, making the connections. So when we have that network, and no pun intended here, not the physiological brain network, but the network within our own communities, and connecting and making sense of what mental health is all about, then it becomes normalized, right? So then we become more comfortable. And so the last 5 years, that has been my agenda, so to speak, is to try and normalize mental health within our communities, just like we would when it comes to our physical health. People brag almost about, breaking an arm, or, how many medications they take for their cardiovascular diseases or diabetes and their insulin, et cetera, et cetera. And they're okay talking about these things. And we know if somebody gives birth, or la samahallah, somebody gets in a car accident, the community runs quickly to help and support the families in the community. But when we hear somebody having a psychotic break, as opposed to breaking their arm, it's not the same response. There's a fear, right? People think that they may catch it like the flu, or it might not marry from that family because they believe that it could be something that could be genetic, which it could be, absolutely. But it's almost that unreasonable fear of them catching what they have, right? So working on normalizing it through these types of programs and talking to different experts in different fields, like what we're doing today, is part of normalizing and breaking down the stigma within our communities. Absolutely. Especially when we connect it to, let's say, the stories of our beloved prophets and the Ahlul Bayt alayhim assalam. And if we talk connected to, let's say, to what happened in Karbala, when we're looking at it from trauma, when we're looking at it from resilience, mental strength, when we use these types of connections in the stories, that also can help us destigmatize as well.
All right, thank you so much. Now, as we know, this topic is about the mental health crisis and Muslim identity. So, Shaykh Hazari, this question's for you. What is the connection between mental health and Islam?
So, the issue of health in general with Islam is integral. It is an integral issue. Why? Because Islam will never advocate anything that harms your health, physically, mentally, emotionally, or otherwise. So it goes without saying that if you were to talk about mental health, that Islam would advocate for good mental health, for any measures, for any way of life, a system that promotes the well-being of the mind. Now, in addition to the physical body, which again is protected by Islam and the things that Islam advocates or asks us to do or not do, the mind takes a special position or has a special role. Why? Because our worship is meant to be through mindfulness. So if you say that there is a relationship between mental health and Islam, you are talking about not only your ability to function on a day-to-day basis, meaning the fulfillment of your needs, but from the Islamic perspective, fulfilling your obligation to Allah subhanahu wa ta'ala. And that's why, take for example, somebody who is drunk. The ayah says, "La taqrabu salat wa antum sukara." Don't approach your salat, don't do salat and you are drunk or you are in the state of intoxication. Why? Well, intoxication and being drunk from drinking alcohol is haram anyways, obviously. But the fact that you now step in front of Allah on your prayer mat to pray and your mind is not there, meaning you cannot coherently speak what you're supposed to speak, you cannot focus on what you're supposed to focus on, is an indication that mental health, well-being, presence of mind is absolutely necessary for the fulfillment of not only daily needs, but worship as well. That goes for salat, that goes for your fasting, that goes for the requirements of being the imam of a jama'ah. When you are leading the congregational prayer, you have to be aqil. You have to be somebody who is quote unquote sane. In this sense, you can differentiate right from wrong. You know what is good for you, bad for you. You have the ability to act with mindfulness. So I think it is a very logical connection that exists between Islam and mental health. And really, the last thing I would mention is that Islam advocates the advancement of insan, the advancement of human beings. It encourages us to learn, to grow, and to evolve, for lack of better term. And the only way that that can happen is with the mind. Our physical body is not going to evolve and improve necessarily. It is what it is. You may become healthier, you may become physically stronger, but it is not going to increase in its capacity. You will not be able to fly one day. You will not be able to swim underwater for 3 hours, but your mind can evolve. Your mind can improve and become stronger and more adapted to the world around it. And I think this is what Islam advocates.
Thank you so much. Sister Berak, often a question that I get, with parents coming in, especially for the young kids, even some adults, is, there's so many different stressors going on in life. And I have to do this, I have to do this. But, my primary care physician told me how to maintain my physical health. But how do I, maintain a balanced mental health? So if you could please enlighten us on that.
So feeding off of what Sheikhna just mentioned and spoke about, it is about that balance, right? It is about looking at, first of all, what is mental health, right? And truly understanding, I think, can give us the beginning to delve into this question. So let's take a look at some definitions. The Canadian Mental Health Association defines mental health as striking a balance in all aspects of our life, so social, physical, spiritual, economic, as well as mental. And the World Health Organization delves a little bit deeper and says that mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to his or her community. For me, when I read this and think about it, it goes exactly with our Muslim values, right? So it makes sense to take a look at the different aspects of our lives to balance it. If we continue a little bit further, let's take a look at what wellness means and the different dimensions of wellness. So the University of California, Davis campus, their student health and counseling services takes a look at dividing up wellness into 8 aspects. So occupational, emotional, spiritual, environmental, financial, physical, social, and intellectual. And when we take a look at understanding what that is all about, it's that conscious, self-directed, and evolving process of achieving full potential, right? So when we take a look at maintaining an optimal level of wellness, it's absolutely crucial to live in that higher quality of life the Shaykh was describing, right? Doing our best to reach our potential. So wellness, why does that matter? Well, because everything we do and every emotion we feel relates to our well-being. So that in turn, where our well-being directly affects our actions and emotions. So it's this ongoing circle, right? So because of this, it is important for everyone to achieve their optimal wellness in order to reduce that stress and reducing the risk of illness, which ensures the positive reactions or interactions rather. So how do we maintain that? So, I've said a lot of jargon here from a psychological perspective. Let's link it to spiritual religious perspective. And I find that it works really well when we take a look at this quote by Imam Musa al-Kadhim alayhi salam, where he says, divide your time into 4 parts: an hour to Allah subhanahu wa ta'ala, an hour to work or provide for your family, an hour to socialize with friends, those who are trustworthy and can keep your secrets, and lastly, an hour for yourselves, in where you can perform what you desire without falling into haram. I love this quote because it shows us right there how to divide the different aspects of our wellness, whether it was the 8 dimensions of wellness, which fit into the 4 aspects here, right? Or the different definitions that we looked at mental health in terms of how do we balance that, right? So it doesn't, if we look at it from the literal sense, it doesn't mean that you divide exactly, 24 hours into the day into this 4 part, because it's a very individual thing, right? Perhaps people need to spend more time at work in order to be able to take time off to spend with family, right? And need that rejuvenation time by spending it with themselves, but also with the spiritual part of ourselves by connecting to Allah subhanahu wa ta'ala, right? So I find that balance is very individual. It depends on your lifestyle, it depends on the demands that you have. But those of us who don't maintain that burn out very quickly, right? So it's really important to have the balance in place, inshallah.
And just a follow-up question for you, Sister Berak. So what role does mental health play in trying to become more religious?
So this is a tricky question because there's no, right or wrong specific answer. Again, it's very individual. When you have that optimal health in terms of balance of all aspects of our lives, like we described, I think this is a positive contributor to us being more religious and vice versa. And if we are, and of course, defining the word religious, that requires, eons of time to get into and delve into. But if we're looking at it from the traditional way of, doing all of our a'mal, being a good human being, contributing to our society, being kind, compassionate, and, following what Allah asks of us, I think they go hand in hand, right? In order to have good mental health, this can contribute to us being religious, and us being religious can contribute to our mental health. So I think they're all in balance with each other. So having good mental health will then allow you, perhaps when you are feeling that you're in balance of all aspects of your life, then you're more likely to, let's say, spend time reading Quran, right? Because people say, oh, if you're depressed, well, that means you have low faith. That means you're not being a good Muslim. These are some of the stereotypes that we have when we look at the attitudes that some people, perhaps the hurtful attitudes, perhaps that people have in the Muslim community, or even other communities of faith, not just Muslims, right? That you're not religious enough. You're depressed because you're not religious enough, right? You're having thoughts of suicidality because you're not religious enough. And I find this is very harmful. It's not a healthy way of helping or supporting anybody. It's also very judgmental, right? And this doesn't work when we talk about helping people who are struggling with their mental health. So there is a role. There's a large role that mental health plays when trying to be religious, but I think it's also individual, and we cannot judge somebody's level of religiousness based on mental health and vice versa. All we can do is be compassionate and supportive and non-judgmental and encouraging people. Let's say, again, I use the analogy of breaking the arm or the leg, is that this person, when they break their arm or leg, you're not going to tell them, you should read specific du'as to help you with the pain. No, they need to get to the hospital, get an x-ray, get a cast on, probably some morphine to help manage that pain. The last thing they're thinking about in that moment is, reading the Quran, perhaps to help them in that. Same thing when it comes to your mental health. When you have a break in your psyche, when you are dealing with a lot of stress and burnout, which can lead to anxiety, or you have social anxiety, or you have borderline personality disorder, the list goes on and on with what types of illnesses there are. And I highly encourage you to watch some of the programs that the Shaykh and I have done, and other programs I've done with different communities doing the mental health one-on-one type of stuff. So we don't use that mentality when it comes to the physical, right? So we also have to take a look at that and be gentle when it comes to the mental breaks that we have. So once the person, let's say, has seen a doctor, has gotten assessed, has perhaps been given medical treatment in terms of actual medication along with therapeutic treatment, then we can look at incorporating spirituality. That's how I do it in my practice, and I find it really impactful, especially when we look at it from an Islamic counseling theory with perspective, which is that the client, the individual, has a lot to do with the treatment and even the assessment aspect of it, right? Because then they take on a more independent role and become empowered when they incorporate the tools that they're familiar with, such as our du'as, such as reading Quran and du'as and our prayers, into the therapy as well as part of their treatment plan. So I hope that was a sufficient answer for this question, because there's so many different ways of looking at it. I just gave you examples of how I do it in my practice.
Yeah. Thank you so
Dr.
much.
Hussain, I actually had something to add, if you don't mind.
Sure. Yeah, absolutely.
Two sentences, and by no means is this any sort of qualified advice. But if we ask the question as to how much does mental health impact our religiosity or our adherence to religion and our spirituality, I think the question also has to be asked as to what affects our mental health prior to that. And I think what a lot of us don't realize is that everything we do in life, from the food we eat, from the information that we consume, the social media, the people we hang around, all of these things have a deep impact on our well-being. And all of those things are first and foremost as a source of stimulus, as a source of activation of your brain and your mind, even though sometimes you're not aware or conscious that it's happening, is going to change the way your mind functions. It's going to change the way you think and perceive things. And that definitely is going to have an effect on your religiosity, on your spirituality. Consumption is what begins the shaping of the mind. From a physiological perspective, they did a very beautiful study in primates many years ago, in which they took a set of infant primates and they covered one of the eyes of the primate. And they only allowed that primate to see from the other eye, the opposite eye. And then they mapped the brain. And what they found was, if they did this at a young age, when the brain was very plastic, when it was changing rapidly, they saw that the amount of the brain that was assigned to the eye that was blocked actually shrunk in size. The brain knew that this organ of mine, this sensory receptor of mine, is not being used. Let me use the brain for something else. And it directed most of the traffic the other way, to the other eye or to the other senses. In this manner, what we consume, the way we use our organs, the things we are exposed to, are going to affect our mental state. And that is going to determine how we pray, how much focus we have when we sit on the musalla, how our fast is going to be, how our hajj is going to be. All of those things are going to be determined by the factors that surround our life. Sorry, I didn't mean to interrupt.
No, Sheikhna, you know, when you said that, it got my brain buzzing and thinking about other things as well, and reminded me of a project that I worked on in terms of looking at how, for example, the impact of Ziyarat al-Arba'in impacts our well-being and our mental health. And I highly recommend you check that out for those who are interested, where we actually do somewhat of a qualitative type of research, connecting with people who are on Ziyarah before, during, and after, and asking this question: how does this impact this? And we cited lots of different research, including from one of our own here in Ottawa, Sister Lorraine Tirani, where she actually took part in a research looking at the impact of spirituality and well-being. So absolutely, there's a huge link between the two. I highly recommend for those who are interested to check that documentary out. It's on The Muslim Counselor. I'm totally not doing a plug-in here. I'm just doing this, I'm just connecting it because we did research this topic in depth from the aspect of ziyarah, and how it's a little bit opposite in this sense, is that we took a look at how ziyarah impacts our well-being, right? But it's all interconnected, absolutely.
Right. Absolutely. We were just speaking about Quran and du'as and ziyarat, and Shaykh, this question is for you. So are there any resources out there that are strictly based off of Shia beliefs on how to combat mental health issues?
So from the perspective of Quran as a source of guidance, as a source of direction for a Muslim, for a mu'min, a believer, someone who depends on the word of Allah, Allah gives both general and very specific advice on those things that you should adhere to. The things that are required of you, those things that are permissible, those things that are prohibited from you. And those are very general. In the sense of the riwayat, in the sense of the ahadith, there are many ahadith that address the state of an insan. However, when you talk about mental health from a clinical perspective, from the perspective of a medical condition that needs treatment, no, there is no such thing that, well, there is a hadith that says if you take XYZ medication, it's going to deal with psychosis, or it's going to deal with someone who's got clinical schizophrenia or something like that. The recommendations, and again, I am by no means an expert even on this topic from the Islamic perspective, but there is a lot of research that is being done from scholars, from individuals who are looking at it from the nas, or the religious scripture that provides you some insight. And all of it is indicating or indicates the fact that there are indirect indications on how to improve your mental health, but not something where if someone were to go to a Maulana, for example, and say, I suffer from bipolar syndrome, or I have PTSD or something like that, what should I do? That should be addressed from a clinical perspective. And Islam can give you general advice. It can give you recommendations on how to improve your overall living, what you consume, how you behave, who you interact with, those individuals in your life who could be potentially toxic to you. But in the treatment of an acute syndrome, a clinical syndrome, you would go to those people who are ahl al-khibra, people who have expertise in the areas of clinical psychology, psychiatry, these sorts of things, who can properly and appropriately help you because they have experience in that area.
Yeah, absolutely. So, one of the most common mental health disorders in the world is major depressive disorder. And, they say that 1 in 5, adults will deal with clinical depression at one point in their lifetime. And, we use a diagnostic manual, it's called DSM, to, clinically diagnose, any psychiatric disorder. And one of the clinical signs of major depressive disorder is hopelessness. And, what I wanted to find out, and, question many have, is what does Islam say about the feeling of hopelessness? And this question is for you, Shaykh.
Yeah, it's a great question. And again, let me begin by saying that from the perspective of clinical depression, this is something that should be dealt with by seeking the advice and professional treatment of a clinical psychologist or somebody who has expertise in this area, who can deal with the causes, who can deal with the factors, and understand why it is this person is experiencing clinical depression. Now, if you're talking a bit about depression that an ordinary human being will feel on a day-to-day basis, depressed because it's gloomy outside, depressed because your favorite soccer team is losing in the Euros or in the Copa America, or you went to the bakery. Yeah, well, I'm not giving the score away just yet. Or you go to your favorite bakery and the cake that you want, the last slice of it just got bought out by the previous customer, and you experience profound sadness. That is a different thing. And so when you talk about that and you talk about hopelessness, Islam says that a believer, someone who trusts in God, should not become desperate or hopeless when it comes to the fulfillment of their needs from Allah. That's why Yaqub alayhi salam, when he spoke to his sons, what did he say? He said, La tayasu min rawhillah. Or the ayah that says, La taqnatu min rahmatillah. Do not despair on the relief that will come from God, God's mercy that will take care of you. From the perspective of faith, dependence on God, we all experience sadness. We all experience moments where our hearts will plummet. We all experience moments where something will happen suddenly that will make you feel like the bottom has fallen out beneath you. That is normal. It's part of life. And what Islam says is that in that moment, remind yourself that no matter how big the calamity, no matter how bad the trial or the difficulty, God is bigger than that. God is greater than that. And that if anyone can remove it, it is Him. And so despair in God, losing hope in God, or having hopelessness that there is no recourse or there's no solution, it is something that a believer wants to stay away from, should stay away from. And the means of doing that is the struggle of life. It is what we fight to ingrain in ourselves from A to B, and we are probably still struggling with it until the moment that we die.
Absolutely. Thank you so much, Shaykh Hazari. Now, Sister Berak, this question is for you. So if one feels if they are having an identity crisis between trying to also maintain their Muslim identity, how can they address that? Because it's a common thing the youth are facing, and quite honestly, many people are facing.
Absolutely. And just like the Shaykh used the word normal, I'd say it's also common, right? Let's take a look at what identity means from a psychological perspective, and then we can get into that. So essentially what it is, it's an individual's sense of self defined by a set of physical, psychological, and interpersonal characteristics that is not wholly shared with any other person, and also a range of affiliations. So for example, ethnicity and social roles. So now that we have that understanding of it, let's look at what it means to have an identity crisis, right? And also trying to maintain that. So identity crisis, what that essentially means is that when you are not understanding, right, what it is. So when you're not understanding what, like the developmental event, so whatever event's happening that involves a person questioning their sense of self or place in the world, right? So, and this idea comes from one of my favorite psychologists, Dr. Erik Erikson. He's a developmental psychologist, looks at the different stages of development, right? And he believed that the formation of identity was one of the most important conflicts that people face in their lives. So the idea here, when we take a look at identity crisis, there's a variety of different symptoms, right? It could be people questioning themselves. What am I passionate about? You know, what are my spiritual beliefs? What are my values? What is my role in society or purpose in life? Who am I, right? So this could be a question in regards to our career, in terms of our relationship, in terms of our age, in terms of our religion. Absolutely, right? So it is normal, I would say, to have these questions of our identity depending on the situations that we experience, right? It's okay to experience that. What's not okay is to ignore it, right? And just let it pile up, and then it could come back at us really harshly in a way where it could affect our mental health, it could steer us away from our faith, and so on and so forth, is when these feelings of uncomfortableness, so to speak, comes up, was we want to look at that rather than ignore it, push it, and deny it. You want to face that through perhaps the exploration with a therapist, with a skilled sheikh, meaning they have the counseling background along with the religious aspects, so they can do really, I would say, good job of connecting the two, right? Not at the expense of one or the other. So it's okay having these types of situations. Sometimes they're forced on us, unfortunately, right? Sometimes they could be forced on us by the society that we live in. And this is most commonly what we see here in North America, perhaps, or different parts of Europe, or non-Muslim countries, or places that Muslims are a minority, is that there is a lot of racism, Islamophobia as well, right? Which forces us to question our beliefs. A lot of women recently, the last month or so here in Canada, have been questioning if they feel safe wearing their hijab because of the Islamophobic terrorist attack that took place on a family in London, Ontario, where they were mowed down by a truck from a white supremacist, right? And this person was identified as a terrorist, as they should be. And, you know, kudos to the Canadian media for doing that, because we don't really see that. This helps as well validate our identity in the sense that, yes, you know what? We were attacked here. We were deliberately attacked because of our faith. So of course it's going to impact our identity. And the women, what I've heard the last month is that they were questioning if they felt safe walking around in their hijab. So this right there can cause that crisis, so to speak, in their identity. A lot of people came back stronger and said, you know, despite whatever Islamophobic attacks or anything happening like that, we will not let it affect our faith or our well-being, in the sense that we will fight back through bureaucracy, through petitioning, through protesting and vigils, through going through their governments, officials, and trying to instigate change, right? So sometimes identity crisis can have a positive outcome, in the sense that they get people to take action, right, where their values have been impacted. Now, I spoke more on a psychosocial level here, but when we look at it at an individual level, I see a lot of young people struggling with that as well, like you mentioned, Doctor, in the sense that they're trying to fit in to their North American society and their counterparts and peers at school or university or in the workplace. And because they look visibly Muslim, especially the women, they could have a lot of questions, right? Sometimes there's that clash with parents as well, along with children at home. And children, I mean, could be youth as well, teenagers, because let's say the parents enforce on their children their traditional beliefs and culture, not necessarily Islam, or forcing Islam in a way that makes the young people say, well, no, I live here in America or in Canada or in the UK or wherever, and I don't have to follow that. I choose not to do that. So there's a huge responsibility of parents, and I think that's probably one of our questions later, so I don't want to jump too much into that. But the idea here is that that can also cause an identity crisis with our young Muslims, is that parents are forcing their beliefs in a way that it's just not acceptable through the mentality of the youth, because of what they're bombarded by, like the Shaykh mentioned earlier with social media, right? And this is how you should be in North America, and so on and so forth. And also, I know I've spoke a lot for this, but there's so much in this question. Specifically, let's look at Muslim women in hijab, in social media, in the media. It's all about fashion now. There's no longer modesty, right? And they've gone from one extreme of trying to prove themselves that they're not terrorists after 9/11, to these really cool, approachable people that can be accepted. And it's gone the complete opposite, where they're matching lipstick to hijab just to fit in, so to speak, right? Sure, there is an expression of identity. There's an expression of personality, but not when it crosses the lines of modesty. And that's a whole other discussion, which we've had before. But it's so interesting when it comes to identity, that we've gone from one extreme to another just to try and fit in, rather than creating our own narrative, right? And especially when it comes to our Muslim identity. And a quick advice to our young people who are watching out there: be proud of who you are with your Muslim identity. Learn about your culture and history and the richness that we have. We don't need to assimilate and conform to what is here in North America. We take the good of this culture and the good of our background to create our own narrative, right? And this is how you can stabilize your identity crisis, having good influences around you, talking to the right people, and taking the time to exploring these questions that we first brought up earlier.
Okay, yeah, those are all really great points. And Shaykh Hazari, we just had a question from the audience that I feel that would fit in well right here. Is, will the concept of takiyah help against any mental health issues?
So when you talk about takiyah, meaning dissimulation, I think that's what you're asking about. In this case, dissimulation occurs. Why? Because there is a threat on your life. There is a threat on your physical body, harm that is real and honest harm that potentially could come to you, or a loss of your property or something to that effect, something that is a belonging of yours. I don't want to get into that topic too much. Why? Because we live in a free society. We live in a society where taqiyya is not really necessary in general. Why? Because we have freedoms. We are protected by the law. We are citizens, and we have the right to speak up if we are being mistreated, if we have been targeted, God forbid. And so, again, I don't want to say that it is feasible or not feasible. Nor can I necessarily say that a study has been done to show that taqiyya leads to better mental health, right? The fact that you are struggling because of your Muslim identity may have multiple reasons. It could be due to societal pressure. It could be due to abuse. It could be due to prejudice, but it could be due to other things as well. And so how do you determine that? That's the question. And Maybe I will say that in certain circumstances, if it is such that the social pressure on you poses a true and real harm, a veritable harm, or a chance of loss of some kind, then yes, maybe taqiyya would protect you. Maybe it would safeguard your mental well-being and help you from having dissonance and stop you from feeling nervous or pressure of any kind. But again, I'm answering it in a very general manner because there's no way to know. And I think Sister Berak said it. It is circumstantial. It differs from person to person. And one thing we have to realize is in the West, we live in free societies. We are protected under the law. We are free to practice our religion in the way that we want to, express our religious identity in the way we want to. And sometimes the greatest inhibitor of that is our own sort of, inhibitions and our own
lack of self-esteem, confidence.
Lack of self-esteem, perfectly put. Yes.
Yeah, absolutely. So Sister Berak, you raised a point a few minutes ago about the role of parents. And, I can attest to that as, a child and adolescent psychiatrist. I often speak to, a lot of these kids alone, of all ages. And one of the common complaints that they have is that my parents are not supportive. And then we have parents that are extremely supportive, but they don't know how to be supportive. So, the question comes up is how can parents be supportive when their child is dealing with mental health issues?
So I work mostly with young adults, university population, as well as adults. So children, I don't necessarily treat them, but absolutely within the community, there's always struggles that I hear stories and people seeking advice, in which then I connect them to therapists who are specifically with children. But in essence, how can us parents be supportive? It is by being compassionate. When a child comes to you and says, I am feeling sad, or you notice that, let's say, they're not engaged as they once were, they're not showing signs of happiness, they're not being creative, they're not connecting with their friends, they're let's say misbehaving in school. And I know with the pandemic, it's been very challenging in so many different ways. Being supportive means sitting down and listening to them, meaning playing with them, right? Maybe drawing with them, playing Legos with them, playing snakes and ladders with them. And I'm saying that from experience with my own daughter, where we've had the most very impactful conversations through just playing together, right? So for young children, playing is a great way of spending, first of all, quality time, rather than watching TV together, unless you're me and my daughter, where we're quite engaged when we're watching cat videos. That's like a whole other level of support right there, and it's such therapy, just laughing at cat videos. Try that with your kids or with your family. It's amazing, especially if you like cats like we do. So a little side note there. But I find when you engage with your child through play, through art, through going to the park together and doing that one-on-one time, this shows support to the child, that, they have your full attention, as opposed to on the phone, talking to other people, or when there are other people around, they're not really feeling supported that way, right? So playing, connecting with them that way, trying to also have the conversation about if there are bullying issues happening, and how to get them to talk to you about that, and connecting with the teachers, connecting with the school. That's really important as well, right? So there's so many different ways we could answer that. And I found that one of the best ways of showing support to the child is definitely doing meaningful activities where they can open up and feel trust. They can feel safe. They can feel that they can share something without being punished, right? That's another thing. So we're looking at older children, let's say teenagers and youth. Perhaps they're interacting too much with the opposite gender, or perhaps they're exposed to drugs, right? And other social influences that could steer them away from religion or just proper moral behavior, right? So creating that relationship of trust is huge. And I've gotten the opportunity throughout the last 2 years before the pandemic hit to do different types of programs and activities with parents and their children, and children meaning also youth, all the way in the States and here in Canada as well as in the UK. And the number one thing that we found that was really impactful and helpful when parents are showing support is that non-judgmental communication, right? The child feels so much support when their parents are not judging them, when the child can come to the parent and talk about their challenges, their problems with their friends, even if they can seem silly. Like when my daughter comes and talks to me about, you know, the Lego piece that's missing, that's a big deal for her, even though for me, perhaps it's not, right? But I have to show, as parents, showing support that that is a big deal, that this was lost or this was broken or this is what happened at school. You know, it starts very young. And if we don't show that support and trust and make it safe for our children to come to us, of course, it's going to impact their mental health in a very negative way, right? So when they come in terms of bullying, if there are signs of bullying, right, and you see the withdrawal and so on and so forth, sometimes a child might be afraid that you might go to the school, right? But you know it's impacting them. If they're having thoughts saying, you know, they don't want to live anymore. And we should have said right at the beginning that we will be talking about topics that are perhaps triggering. If you do get triggered at any point during this session that we're doing, please don't hesitate to reach out to supports within your community, whether it's Nasiha, telephone, or in the UK, the Muslim Youth Helpline. Please don't hesitate to reach out to them as well if at any point you do feel triggered. So again, a long answer for this question because it's such an important question, and there's so many. You could have a whole program just talking about this, mental health in children and families and how to find support. But again, the most important thing is to have that open communication, non-judgmental attitude, even if it's something you disagree with or you don't like, or let's say it's against Islam. We have to be able to provide them that space where our children can feel safe sharing with us, and then we can perhaps go with them to the appointments or see if we could perhaps get a counselor for them, right? Where if they can't share with us, perhaps they can share with a therapist to get the support that they need, inshallah.
Yeah, absolutely. And, you know, that leads to a topic is when do you recognize that you need help or it's time to go to a professional, whether it's a counselor, a psychologist, a Shaykh, a psychiatrist, when is the right time to get help? And this question is for you, Sister Berak.
So it's really important to be very aware of, so is this question about children or us specifically?
Anyone, children
okay.
and adults, yeah.
All right, so I'll answer both ways. So if it's our children, like we said, be aware of their normal behaviors, the way that their characteristics are, how they interact with each other in terms of the home or their siblings, family, friends, and school. If things are off, meaning that they are not their usual personality, you know, in terms of how they behave, in terms of their eating habits, sleeping habits, perhaps, you know, anger, perhaps sadness, if this is going on for a long period of time where they are not their usual functioning self, then this is where I'd be concerned. Same thing with adults, right? If people are missing work, their grades are slipping, they're not attending the Husaini or the masjid like they used to, they're not going out with their friends, their hygiene is off, right? And this is going on for a long period of time, and long period, usually technically, clinically, we take a look at 2 weeks consecutively, right? Because like the Shaykh mentioned earlier, we have highs and lows, ups and downs, and this is normal. This is absolutely normal. It's when it's consistently like that, right? Losing weight, gaining weight, lack of sleep, hygiene, loss of interest. So these are signs of depression, right? So loss of interest in what they once were engaged in, then that would probably be the right time to perhaps approach the person and say, hey, you know, we've noticed this. Do you want to go for a coffee and talk about things? Hey, you know, how about we go together, get a counseling appointment? I can come with you to the doctor, right? If it's your child, definitely take them to the doctor, get them assessed, see what's going on. Perhaps it could be a chemical imbalance that's happening. Something perhaps has happened. For example, in an abusive situation to the child or your friend or anybody else, or even to yourself, right? I find that a lot of people, and forgive me for bringing this up, but a lot of people who have been sexually assaulted will keep it to themselves for a long time because there's so much shame around that. And then their mental health is really impacted, and they'll come later to get help. And they feel like it was their fault. There was a sense of shame, et cetera, et cetera. So they notice that for a long time, they're not themselves. And they finally, when they come out to get the help, I would say it's never too late kind of thing, because there's always that opportunity of getting the support and help that you need. So to summarize this, if over a period of 2 weeks, somebody's exhibiting a lot of the signs and symptoms that we spoke about, then this is the time I would go get myself physically checked out by a doctor who can then do perhaps a mental health assessment themselves or refer on to a specialist to get the appropriate support, inshallah.
Thank you so much. Shaykh Hazari, this question, is often asked, is that are there any traditions of the Ahl Bayt al-Islam that address depression or grief specifically?
Yeah, so there are, one comes to mind in particular in which it is related or reported that Rasulullah sallallahu alayhi wa alihi wa sallam, he was walking by and there were some men gathered. And when he came close to them, he asked them, why are you gathered? I see that you're gathered here. Something is happening. What is happening? They look at him and they say, Ya Rasulullah, hada majnoon yasra. There is a man here. He is afflicted with something. His mental state is not good. And he is acting strangely, as the tradition relates. And so they say, we have gathered here, we're trying to see what's wrong with him. Mentally, he's not acting normally. And so the word they use is majnoon in Arabic. In Arabic, majnoon can have the connotation of someone who has a mental disability and is acting in a manner that is mentally not proper, not balanced. So Rasulullah sallallahu alayhi wa alihi wa sallam, it is reported, he says, لَيْسَ هَذَا بِمَجْنُونَ وَلَكِنَّهُ الْمُبْتَلَى. He says, this person is not mentally unstable. He is not mentally, the word majnoon is not used for him. He says he is someone who has an affliction, who has a sickness. And in doing so, the connotation of this hadith, if I understand it correctly, is that, again, there are qualities that, and the hadith is long, it describes that Rasul describes a person who is majnoon, quote unquote, as the tradition relates, as being someone who is haughty, someone who is full of themselves, someone who has qualities that from the characteristic and personality perspective are considered to be lowly in the eyes of God or religion. But that's why he differentiates somebody who has those haughty, arrogant, sort of self-engrossed qualities versus someone who has a mental affliction. And I think that is what the reported hadith is talking about. And if I understand it correctly, and again, some of these hadith are written or are transmitted to us in a manner that is quite general. So in its interpretation, we have to turn to the scholars, the ones who understand deeply the meaning and the context of it. But when you talk about somebody who is mubtala, somebody who has an affliction, you are talking about somebody who has some problem with their self, their physical body, their mental state, their emotions, such that this is considered not to be something that they consciously are doing themselves. It is something that is occurring due to a deficit, due to some aberration in the body, some dysfunction in the body. Hence, the hadith talks about it in this manner. And there are other hadith that similarly address the state of the mind, the mind that either is just not able to recognize right from wrong, not because the person is evil, but because the person does not have the capacity to do so, or that the person cannot understand mere facts. They will go and they will jump into a fire, not realizing that the fire will harm them. Mentally, they just don't have the capacity to understand those things. And so in that respect, there are traditions and there are things that are reported to us that talk about this sort of quote unquote affliction or deficit from the mental perspective.
Thank you so much. Just a follow-up question from the audience, and this may be an easy topic, but I think it's an important question, is about suicidal thoughts. God forbid if someone were to have suicidal thoughts, what would your advice be, Shaykh Hazari, from a religious standpoint, and what does Islam say about suicide? And then also after that, Sister Berak, if you can add from a psychological standpoint.
Yeah, so my answer with this is very simple, very easy. Obviously, we know what Islam says about suicide, about taking your own life. So I don't need to address that point. But from the perspective of if someone were to come to me and to say that I am having suicidal thoughts, I will immediately say that you need to talk to a mental health specialist, a professional who can adequately assess why you're having these thoughts, determine a course of treatment for you, and determine how it is that this does not happen, really, not just from the perspective of the thoughts, but wal-ayadu billah, that you, God forbid, carry it out. Yes.
Can you just repeat the question again about the suicidality?
Yeah, so Sister Berak, from someone who were to have suicidal thoughts, what advice would you tell them, from your standpoint?
So I don't have, black and white answer to that. It's a whole process that we do in a session when a client comes to us saying that they've had suicidal thoughts. It could range from them having thoughts but not wanting to act on them. So sometimes people have thoughts that just come into the head about not wanting to live, not necessarily that they want to take their lives, but rather, let's say the stress is so overwhelming that they say, I don't want to live this life. I don't want to be alive. But that doesn't necessarily mean that they are having active thoughts of harming themselves, right? So there's so many different levels to it. Somebody who, let's say I would ask them, do you feel that after we speak today that you might do something to harm yourself or might want to do something to end your life? If they say yes, then I would get a doctor involved. We would then need to take them to the hospital, either by ambulance or them voluntarily. At the hospital, they do a full psychiatric assessment. They make sure that they safeguard the patient, that they're safe, that they're not going to do something to harm themselves. And they go through a whole variety of therapeutic treatments, whether it's medication or therapy, right? So again, there are levels to how we go about doing this. This is usually the ABC. And depending on the person in front of us, if you have somebody of faith who says, I know it's haram for me, or it's a sin for me in my religion, because I do have that from other faiths as well, to take my life, I would never do that because I don't want, they'll tell me straight up, I'm a Muslim, it's haram in our faith to do that. They'll say that, or things around, I would never do something like that to hurt my family. So right then and there, what we want to do is assess things worth living for. Not wanting to hurt their family is something in terms of wanting to live for, something good to live for, right? And it's like I said, it's a process that we go through with somebody who is suicidal to working on the things that are worth living for, to the point where we make a safety plan as well, right? So safety plan could be making sure that they do a written contract with myself as a witness in terms of, when I feel suicidal, this is what I will do. I will call these 5 people. If I don't get them, I'm going to keep trying until I get them. I'm going to be calling the emergency. So we'll have that written out on our contract, right? Also, in terms of soothing things that I could do to help distract me in a healthy way, one of which is eating chocolate. I actually have that right written down in my contracts with them. And see, we laugh and smile at that, but there's something about chocolate that, the release of those endorphins in our system that make us feel happy, right? So we include that in there. It is humorous, but some people can really like that, right? Now we get them to sign this contract, and then they know the people in those moments when they're having their low moments, who they can talk to, who they can connect with. And if it truly is urgent, then they know to go to the nearest hospital to get the help so that they're not alone, right? So sometimes this could happen because people are dealing with a lot of, let's say, trauma. Perhaps they're dealing with past childhood trauma that's come back to impact them. Perhaps something recent happened that has triggered them. Perhaps they're dealing with depression, right? There are people who have chronic depression, major depressive depression, and so on and so forth, but they are constantly suicidal. People with borderline personality disorder, they jump from the extreme of, wanting to kill themselves to telling people, don't leave me, but I hate you, kind of thing. So bipolar as well, you have the highs and the lows, and the lows could include self-harm, right? People also have cutting tendencies or physically harming their body. So again, there's a whole process to go through when people come to us and they say they do have suicidal thoughts. Sometimes I actually have to reschedule my next appointment, or I'll contact the office, get them to reschedule because I'm with a high, you know, a person in crisis, right? So that needs a high risk. So that means that we need to spend a little bit more time making sure that they're safe. I'd get them, because we're all doing this virtually, it's a little bit different than when we had people in front of us. In the past, what we've done is right away we'll connect with the doctor who will then form 1 here in Ottawa, Canada, and send them to the hospital, right? Sometimes they're escorted by police as well. So it can get quite intense at times, right? So, sir, I just went through the whole clinical process of how we go about doing it. What I recommend for our communities is if each of the centers can get the ASSIST training. So that's an acronym. I forget what it stands for right now. I have the certificate somewhere, but it's a great program that anybody can take, the ASSIST program, where it can give you kind of like the mental health 101 first aid type of thing of what you need to do with somebody that comes to you. You don't necessarily have to be a trained professional. I highly recommend it for our frontline workers in our messages, our sheikhs, you know, to take these types of programs, including the training for, it's called the mental health first aid. This is basic first aid, just like first aid, it's mental health first aid, and it can give you the basic skills to help somebody in crisis to get the support and help that they need. So highly recommend these for all of our communities to have them, inshallah. The leaders, the youth leaders, the sheikhs, the women committee, you know, anybody in a position of responsibility and leadership to take these just like you would for first aid. They're highly, highly beneficial. That way we don't run from crisis to crisis, that we have people in the community who understand how to deal with these situations, inshallah.
Thank you so much, Sister Berak. That was really good advice, and I think it's something that is very useful for our communities. Shaykh Hazari, so, you know, often, you know, patients that I have seen, sometimes they come in and they say that, you know, I'm dealing with depression and anxiety, and I was working with my therapist and they suggested music therapy, or get like a dog for pet therapy, or do something which, you know, could be considered haram in Islam. So what advice would you give to someone who is getting clinical help, but they may get suggestions to do something that is haram?
So obviously, you can't do anything that is haram. You should stay away from those things. Let me say it quite unequivocally, that you should stay away from anything that is prohibited. And why do I say that in as clear and sort of frank manner as I've just done? Well, there are studies. I'm a cardiovascular researcher, and I know that there are studies that quite conclusively show that drinking red wine is in measure is good for the heart. It's actually good for the cardiovascular system. And in fact, there are some studies that even suggest that by extension, drinking any type of alcohol in moderation has beneficial effects for the heart. So does that mean that now suddenly... Sorry?
Is it because of the antioxidants? So you could take dark chocolate for that, right, instead?
Yeah, so you took the words right out of my mouth, basically, right? Well, the chocolate will go into my mouth then. But I would say in this case, it's exactly that just because this thing that is haram, drinking alcohol, drinking red wine, is absolutely prohibited, just because it has been found to have a beneficial effect, doesn't mean it's the only solution to your problem. You could eat dark chocolate. You could stay away from the high salt. I know the Desis particularly don't like this, but lots of oil, lots of spices, lots of salt, stay away from all of that. And I am a Desi saying that, right? So that'll protect you. You don't need to drink the red wine. That's just an excuse. In the same manner, when you have a circumstance where maybe you are suffering from some mental health issue, and again, I can't speak to what is appropriate treatment or what is the appropriate modality of treatment for a mental health disorder, but I can say from the perspective of Islam, or at least ask the question, that is music the only solution to this problem? Is it the only way in which I can solve this issue? And I'm almost certain that the answer is no, that there are other ways to deal with the issue. That being said, not all music is haram. Music that is for entertainment and for amusement and for those sorts of gatherings that that music is being played for amusement and entertainment, that is haram. Singing is haram. It is not allowed. It is not permissible. But then that means that there is some amount of music or some categories of music that don't fall under amusement or play or entertainment, and hence may be considered to be acceptable. So maybe it is worthwhile to find that quote unquote halal music that may be able to help you. Don't make yourself so bound to the fact that I have to do this because that's what the doctor said. Yes, listen to the doctors, listen to the professionals because they are ahl al-khibra in this field. They have expertise in the field, but realize that you should never violate the laws of God, because that means that you have decided that someone else knows better for you more than Allah subhanahu wa ta'ala.
Absolutely. Absolutely. Great point. And this brings me to a question that I just received from the audience. Sister Berak, this is for you. Is what are your thoughts on psychoanalytical therapy? And if you could just, for the audience who doesn't know about psychoanalytical therapy, just give a brief snippet.
So psychoanalytical theory is based on Freudian theory, which has been mostly debunked now. He's been called the father of psychology, at least in the Western world. And he's got some really fascinating and strange theories that are very, what's the politically correct word to say, at odds with, let's say, a lot of the Abrahamic religion and a lot of the what mainstream psychology as well that wouldn't necessarily agree, right? So Dr. Sigmund Freud is almost like a pop culture of psychology, and you hear about him. So let me just give you a proper definition of it. And essentially what it's all about is taking a look at how to organize personality in terms of how see, this is a tricky question. This is what we learn in micro counseling, and then we kind of forget about it and then just take some of the skills, and especially if you're not trained in that specific area, right? So it's essentially the dynamics of personality development that guides psychoanalysis. So it's a clinical method for treating psychopathology, right? Like we said, it was Sigmund Freud who first brought this up in the 19th century, and it's been changed over time. Like his work has been modified over the decades, right? So he takes a look at using theories such as free association, transference. So this is his area. And he's known for this book called The Interpretation of Dreams, okay? So it focuses on the unconscious, right? And like I said, I'm not trained in that area. I'm more into the cognitive behavioral, so behavioral psychology, more the existential psychology, so using spirituality and so on and so forth. So I just want to make sure, did I answer the full question? I'm trying to see it on YouTube as well. I don't see it there.
Yeah, you did. Yeah.
Okay.
Yeah.
And and a lot of this also, in terms of psychoanalysis, is devoid of faith, God, and religion, which is at odds, again, like we said, with Abrahamic religion, right? So I would recommend, if you want to learn more about it, just read, there's lots of information out there about this, and just to see if, it's like I said, it's evolved over time. There's so many different schools of thoughts that we have now in psychology. It's like we have in religion, we've got the different madhabs. In psychology, we have different schools of thoughts as well. And people adhere to the specific schools of thought, which over time have also evolved into having all sorts of different theories and practices now that we put into play. I'm more on the humanistic existential, like I said, which incorporates spirituality and faith, and also working on developing Islamic counseling theories that we can actually put into practice, which is what I based my graduate studies on.
Awesome. Thank you so much. So one common question we're getting from the audience, actually this is a two-part question, but I'll relay the first part, is around the pandemic. As we know, this past year and a half has been really different for all of us, all across the world. And we've been, basically like in our houses, not been going to the masjid, not having socialization, not going to school. Even specifically when we talk about children, not having play dates, and kids can, feel isolated. And especially when we're talking about the young children population around the age of 3 or 4 or 5, they're missing out on one of their most critical years of their life in socializing and being out and seeing the masjid. So what advice, from both of you, if you guys can chime in, can you give to the parents who, are dealing with young kids who are missing out on those crucial years?
Go ahead, please, Shaykh, you first.
So I'll give just the my own personal stance as a father, really, to be honest. I think that's really the only thing I could say. And that is, my children are not young, so they don't fall into this category. But I would say, get them off of their devices, for one. I grew up in a time when there were no devices, there was no internet. So we were playing in the dirt outside all the time. And that's really because there was nothing else to do. There were 2 channels on TV. And so if you didn't go out and play, you basically stared at the blank wall the whole time. So I would say you have to some degree, take your children and get them outside. And I think part of why that's challenging is because to some degree, we've become parents who are hands off. It is much easier to send your child to their room and be on their device. We allow our children to do that in the centers because we don't want to have to discipline them or keep them engaged in the speech. So we say, here, take my phone, sit there and watch something quietly, or go to the corner. In the same way, we are now home, we're working from home, and our children are with us. And so it's easier just to say, go up to your room, do your class after you have your class, sit on your iPad or your iPhone or whatever it is. And unfortunately, it has become an easy way out. And what is harder is to say, I'm going to take my child and I'm going to go out with my child and I'm going to run around the backyard with my head cut off, even if it is for a half an hour, just to break the stress and the monotony of the day. Even if my child has a lot more energy and I'm huffing and puffing after 10 minutes of doing this, but at least you've gotten out. And there's such an amazing power of greenness. That's why green space, I do research on green space. Green space has such a positive psychological impact on us. Green color. That's why the color of Islam is green. Our flags are green. Take them out and just get them to see the green grass and the green trees. And just even 10 minutes of that is psychologically uplifting. But what it'll do is it will cut you off from that continuous feed of information that's coming from the blue screen of your iPad or your iPhone that has almost a numbing effect to it. And there are studies that show this, that looking at your iPhone and iPad actually has quite a numbing effect. It makes you almost zombie-like. And I'm not trying to quote The Walking Dead or anything, but cut off the iPads and the iPhones and take your children by the hand and go outside into the greenery. And allow yourself, and maybe even, another good thing is do Salat al-Jama'a with your family outside. It's summertime, weather's nice. North Carolina is a bit humid and hot. It's like 95 degrees and high humidity, but Chicago is good, I think, and Ottawa is even better. So get out and do Salat. Father will lead the prayers and everyone will stand and pray and have a little picnic outside. Believe me, it'll do wonders. It'll be amazing.
Yeah, absolutely. Absolutely.
Yeah. I absolutely agree as well with everything the Shaykh said. There's so much studies out there showing the impact of nature on our well-being and mental health, especially during the pandemic, how that can really give us so much more energy, right? I'm also thinking of the studies done at Carleton University where I work, the happiness lab that we have there. I forget the name of the doctor, but they did research on a group of children here in Ottawa who went to a museum for a field trip during the day, right? So they went to the War Museum and they checked their wellness and mental health and so on and so forth. And then the next time they took them outside, like an all day, and we got lots of trees here and forest in Ottawa and Gatineau area. And so they went and did the field trip outside, and they noticed that their mental health, their well-being, they were so much more happier that day than when they went to the War Museum, again, going outside, right? So absolutely, there are different things we can do. And the Shaykh mentioned them, is to play with your children. I mentioned that earlier as well. I know it's really hard and challenging, especially when you have more than one child at home. It's so much easier just to throw a device at them. But no, why don't you get some coloring books, get some activity books as well, crafts. And I'm also speaking from experience because my daughter is the craft queen. They love doing hands-on stuff, building, creativity. And again, I grew up in semi-digital, non-digital age. As a child, we played store, you know, we loved the cashier. We played with things like that. And creativity and imagination goes a long way. You can't go to the mosque. What people have done this year is they brought the mosque home. They built a little masjid corner in their home, right? And they did all sorts of amazing spiritual rituals and traditions that they built around the COVID time this year, and created that for their children, especially when it first hit last year in Shahr Ramadan. People have high levels of resilience. Believe it or not, human beings are resilient. And we can adapt and change according to the challenges that come our way. Just look at how we've gone from in-person events to doing these online events. And I can attest to this because I used to travel at least once a month to a different country or city once a month, okay? And now I'm thinking once a month. Now I do 2-3 times, sometimes in a weekend, and I'm all over the different continents and time zones in a weekend. So we have absolutely adapted to the challenges that have come our way. And inshallah, we can do more and more depending on what's going to happen. But now that the weather is nicer in our parts of the world, please take advantage of that. Go outside, go to the beach away from, you know, certain scenes, but go get your feet in the sand, in the water, hug a tree, grounding yourself, doing mindfulness meditation, just playing, just walking, taking a hike, you know, an actual taking a hike can do wonders for you and your children. And it's about that time together, right? Putting away your own device when you're with them. Sure, using the devices to capture the memories is one thing, but spending that quality time together with your children. And especially now, the younger ones, if you notice, some children are actually born during the pandemic. I met some people who said when we went to the first Palestinian protest about a while ago, the mother was telling me this child was born during the pandemic. They don't know how to socialize or connect with other people, and seeing that many people around was quite frightening for them. That says a lot, right? So it's an opportunity now in small groups, perhaps reconnecting with friends and family, to allow our children to have those psychosocial development and just being able to connect with people again. That's really important, especially as children. They are social little beings as well.
Yeah, absolutely. And a follow-up question for you, Sister Berak, from the audience is, how do we identify and differentiate COVID-related isolation or lack of interest versus is this depression? Because even in my practice, I'll often have adolescent kids say, am I depressed or am I losing interest because this is the normal life now? So how would you address that?
So I wouldn't be surprised once, inshallah, this pandemic is over, we actually come out with new terms to put into the DSM when it comes to COVID. I wouldn't be surprised. I mean, people are coming up with terms like COVID babies, who are born into the pandemic and so on and so forth. And I've seen this in my practice, especially with the university students, where they were not people who engaged who were not experiencing depression, who have now become depressed because of the isolation. So it's hard to differentiate. And this is where our great doctors who do mental health assessments come in, because then they will do the assessments to see if this person, let's say, has a family history, there's a genetic factor, et cetera, where they could have been always prone to depression, right? Or is this situational? And most of the time, what I've seen with that increase of depression, it is because it is situational, right? And so we look at how to engage students. I work as the international student counselor with the international students, where can you imagine coming to Canada as international students, and especially those who came last January in the heat of, actually in the coolness of the pandemic, so to speak. they were isolated. They were in the dorms. They were not connecting with people. They didn't see anything as normal students when they first come into the university, with the orientation, connecting with different services, societies on campus, services that if they need help, they can go get it. So a lot of these students who are cut off from the families back home and dealing with culture shock and adjustment are now isolated in their dorms or apartments, wherever. And because of the -30 weather or the +35 weather, it's really hard to connect, right? And of course, they're going to have that depression. And I would say a lot of it is because it is situational, not necessarily because they are clinically depressed. And so we look at working on that, connecting them with mentors, connecting them to the online programs that we do have. Now that we have some lockdown restrictions lifted, people are going outside, patio, people are watching the game earlier out in patios right now, patio life is great, minus the alcohol, of course, but and we've got lots of halal restaurants that are doing that now. Everybody's doing patios. That's the only way they can survive these days. So we have a lot more opportunity now to connect, to reconnect. I know a lot of our messages and Hussainiyas, I know in the States, here in Canada as well, they've been opening up slowly still with restrictions, but do get engaged. It's almost like we've forgotten how to socialize. A few weeks ago, my friend and I went to get our eyes tested out at my brother's clinic, and it was such a novelty to walk in the mall, although all the stores were shut except for the pharmacy and the food court and the optometrist office. We didn't know how to behave anymore in the mall. We didn't know, like, how are you supposed to interact? And it was so interesting to see that. And a lady who passed by us started laughing at us, and she took off her mask and said, we don't know how to behave socially outside anymore. So she completely validated and reiterated what we're experiencing. So it's really interesting to see slowly as we get back into interacting, going back into malls, going outside with the change of weather, how this impacts their well-being. I've had students within the last few weeks of our restrictions being lifted like this, the depression was gone, like that, because they were going out with their friends, they were playing sports outside, they were connecting with nature, they were sleeping better, they were eating better. It was all situational for them at that point.
Thank you so much, Sister Berak. That was a really good perspective. With this being said, it leads to the conclusion of the questions for the program. Once again, on behalf of the entire Chicago community and IEC Husaini Chicago and the Board of Trustees, I'd like to give my extreme gratitude to both our speakers today, beginning with Shaykh Dr. Mehdi Hazari and also Sister Berak Hussain. We have posted the information for email addresses for both these speakers if you need any additional questions. We also have additional resources within the Chicago community, including myself and Sister Sajida Saiyed. We posted our email addresses. Please feel free to contact us with any questions, and also please feel free to contact Maulana Mehdi Najafi, who is our resident Alim. He's done a fantastic program for the youth on mental health recently. And with this being said, I'd like to call on our resident Alim, Maulana Mehdi Najafi, to say closing remarks.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
Thank you very much, Dr. Kumail Hussain. May Allah subhanahu wa ta'ala bless you for arranging such a beautiful session with such important scholars, mashallah, and experts in the field. So I thank my very respected brother and Alim and friend, Dr. Mehdi Hazari Sahab, and also Sister Berak Hussain, mashallah, for very important information that you have provided, very great presentations. May Allah subhanahu wa ta'ala bless you both and give you more tawfiq to serve the community and help our youth. Of course, I was driving and I was not able to hear the whole session, but in the end I was here, mashallah. I heard both of you. speaking on various topics and very good questions were there, and very, very impressive answers. If I want to conclude whatever you all have said and what it should be done, see, there are two types of people. One who is already suffering from kind of a stress or depression or anxiety, and one who is not. For both, there are different approach should be, and it is different approach from Islam. Those who are already suffering, they should seek immediate help, medical help, and go to the experts of the field. Of course, Islam will help them too, and but only Islam is not enough there. Why? Because there are two things we have in our body that Allah subhanahu wa ta'ala created. One body and one our spirit and ruh and our mental system. For body, Allah subhanahu wa ta'ala has said, Kulu washrabu wa la tusrifu. Eat and drink, but don't exceed. So this is for the beginning, so that you be safe from any kind of sickness and illness. Islam protects you from very early beginning, from anything that's going to harm you ever in your life. All haram and halal in Islam is this: to keep you healthy. The goal is keep you healthy, physical health and mental and spiritual health. Sharia is this, the whole Sharia, all the Islamic laws. Islam is code of life, means Islam wants you to be a healthy human being. So if Allah forbid somebody is suffering from this, he should immediately seek that help, plus seeking Islamic counseling too. No problem. Just like somebody, if he is sick, he should go immediately to a doctor. Plus also he can do dua. Why not? Yes, of course. Dua also will help. So both go together. But in the beginning, early, if you want to prevent such thing to happen, what you should do, you don't need to go to the doctor for that. Yes, for the advice is good. Seek the advice. But mashallah, if you are healthy, you're not going to go to the doctor when you are healthy. But what you do, you learn the tips that you don't need to go to the doctor in the future, inshallah, and you be healthy always. How to do that? This is what Islam is teaching us. Keep healthy. Don't do anything which harms your health. Any health, mental health, any kind of health. How to do that? How? So I think Maulana Shaykh Hazari and Sister Berak also, both of you have covered this, I think, this issue of hopelessness. See the word israf, subhanallah, Quran is miracle, wallah. In both places, Allah used the word israf. Israf, exceeding, excess of something. Kulu washrabu, eat and drink. If you want to put the entire medical science in one side and this Quranic words in one side, I think this will be more valuable. And all medical science is based on this. Kulu washrabu, eat and drink, but don't exceed. Be balanced in eating and drinking, you will be healthy. So israf means if you do something which you're not supposed to do, and this way you will lose your health. The same word israf Allah used for mental health. How? قل يا عبادي الذين أسرفوا على أنفسهم لا تقنطوا. أسرفوا على أنفسهم. لا تقنطوا من رحمة الله. This is, brothers and sisters, one of the best solutions that Quran is giving us. One of the best solutions. Allah says, قُلْ يَا عِبَادِ, tell my servants. See the love and mercy from Allah in addressing, قُلْ يَا عِبَادِ, tell them, oh my servants. Just like a father says, oh my son, why you are, why you worried about anything? My son, why you worried? A mom, takes her child, why are you crying, my son? See the love and mercy from Allah. Tell them, oh my ibad, oh my servants, la taqnatu, don't lose hope in mercy of Allah subhanahu wa ta'ala. Don't lose hope. Anything. See the definition of stress that has been given by the experts is this. Stress is a condition or feeling that somebody is experiencing when a person perceives that demands exceed the personal and social resources. That individual is not able to, achieve those. Exceeds means he has a problem, but he doesn't have the solution. This is the stress. What is, what else? This is the stress. Allah says no. Ala bi dhikrillahi tatma'innul qulub. Of course, again, this is for those who want to prevent this to happen. Don't just rely on du'as only. This is not acceptable in Islam at all. You say, I am sick, I will not go to the doctor, I will sit and read dua. No, both together. So when this happens, you will feel comfortable, peace of mind, tranquility. La taqnutu min rahmatillah. And what did you read in Dr.kumail? برحمتك التي وسعت كل شيء. I ask you with your mercy that had encompasses everything. Encompasses everything. And one more. This is the last. Otherwise, just keep just speaking. Because all our majalis or tafsir, everything that we say about Deen and Islam is this. We just keep talking hours and hours, will not end. Islam wants, see, this is the conclusion. The entire society, whole society, the entire environment should be peaceful environment for our kids. The community environment should be peaceful, comfortable environment for our kids, for our youth. The center's environment, entire environment, all the arrangements, everything should be peaceful for them. They should love to come to center and feel comfortable when they be there. The home environment to be good. And parents also are responsible. So everybody is responsible here, starting from parents to community leaders, to Alim, to entire community. All of us together can work to solve these problems that our youth are facing. And keep in mind, inna ma'al usri yusra. There are tens of ayat that even just single ayat can give you comfort. Inna ma'al. Amazing. Allah says with every difficulty and hardship, there is an ease. With, not after. Ma'al. Not ba'd al-usri yusra. Subhanallah. Inna ma'al usri. You have pandemic? Oh my God, I have pandemic. Okay, this is a challenge, but there are so many opportunities in the same pandemic. Why should we cry about pandemic? Why should we be worried about? So see, many things are connected to your faith. When we say that faith and that's why faith-based counseling is very effective counseling. All agree, even the counselors and the experts, they agree the faith base. Why? Because somebody has something, has a ground, and you have to just build something on that ground. The counselor, feels easy to talk to someone who has a ground. Anyway, may Allah subhanahu wa ta'ala give us tawfiq to work together to do really something for our youth. Otherwise, we are living in such a time and in such an environment in which the information and the statistics are very alarming. I will give one just one information in less than 1 minute. So we know the importance of such sessions, why we should repeat these sessions, and why me, myself, personally is very much concerned about our youth. See, it says approximately 1 in every 5 young adults between the ages of 15 to 24 suffer from clinical depression, not just regular depression, not just stress. 1/5 of the youth in our country here, they suffer from clinical depression. So how can we forget our youth? And around 5,000 within this group commit suicide every year. Recently in our community, 2 cases I know that happened recently. Suicide. This is serious. We have to take it serious. And we have to work together. The entire community. See, in such a seminar, the whole community should come and attend such important seminars. They say, no, because we don't have kids, we don't care. No, you should care because all kids are our kids. The community kids are our kids. Community youth are our youth. We have to care about them. May Allah subhanahu wa ta'ala reward you, every single person who participated in this seminar, and especially our scholars. Thank you very much again, Maulana Dr. Mehdi Hazari, and thank you again, Sister Berak Hussain, and thank you, Dr.kumail Hussain, for arranging this amazing session. Jazakumullah khair. May Allah keep every evil away from all of you and from all the community and overall from the humanity, inshallah. May Allah subhanahu wa ta'ala protect our youth from any kind of illness or disease or sickness, and may Allah give them health, spiritual health, mental health, physical health, so that they be really truly, they can serve Allah subhanahu wa ta'ala. قَوِّ عَلَى خِدْمَتِكَ جَوَارِحِ. Allah, straighten my limbs so that I can serve you. So we cannot serve Allah if we are not healthy. So we have to take care of our health. Ya Allah, give us tawfiq that we take care of our health and the health of our community, inshallah. And give us tawfiq and strength, mental and spiritual and physical strength, so that we be able to serve our Imam Zaman Ajjalullah Ta'ala Farajahu Sharif. Ya Allah, hasten in his reappearance and keep us among his supporters and his followers. Wassalamu alaikum wa rahmatullahi wa barakatuh.